Recording in progress.
Hi, Liz. I know you are signed on as Secretary Shaw. May I get a mic check? Will you please count to 10? Liz, may I get another mic check? 10 count, please. I still haven't been able to hear you.
Testing audio, testing.
Thank you very much. I got your audio. You sounded great.
Thank you.
Hi to all the reporters who are on right now. We appreciate you. I can see about 20 of you on. We are just waiting for a few of our subject matter experts to join, and then we will get things started. So thanks again and stand by. All right, Michelle, I can see you and I see Lacey as well. We are going to get started in about 1 minute. All right, hello everyone. Good afternoon. Welcome to the Wednesday, September 29th COVID-19 response media briefing. I'm Julie Grauert and I will be your facilitator for this event. I would like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary, Lacey Fehrenbach, Deputy Secretary for COVID-19 Response, and our guest panelist today is Dr. Daniel Getz, Chief Medical Officer at Providence Sacred Heart Medical Center and Holy Family Hospital. To begin today's briefing, we will open with remarks from Michelle Roberts. Go ahead, Michelle.
Well, thanks, Julie, and good morning, everybody. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. I want to start today with sharing some good news. Vaccination rates are rising. Since the middle of August, we've seen a 25% increase in the number of people who have initiated vaccine in our state. This is fantastic news. More than 4.9 million people in Washington have received at least one dose of COVID-19 vaccine. That's more than 6% of the state's eligible population. And other good news is that nearly 70% of people 12 and older are fully vaccinated. We're closing the gap. Across the state, the number of eligible unvaccinated people is down to about 1.5 million people. If you're one of these people, what are you waiting for? Getting vaccinated protects you, your family and friends, and your community. Head to our vaccine locator website and make your appointment to get vaccinated today. Additional good news is that when we update the state's vaccine dashboard later today, we will report that the 9 millionth dose of COVID-19 vaccine has been given in Washington state. Thank you to all the Washingtonians who had made the choice to get vaccinated and do your part to help our state fight this pandemic. I now want to move on to Pfizer vaccine booster doses. Pfizer vaccine booster doses are now available for certain groups of people who've completed their Pfizer vaccination series 6 months ago or more. The FDA and CDC recommend some people should receive a booster dose. And those groups are people who are age 65 and older, people of any age who live in a long-term care setting, or people who are 50 to 64 years of age who have an underlying medical condition. People age 18 and older may receive a booster dose if they have underlying medical conditions or if they're higher risk for COVID-19 exposure or transmission because of where they work or if they're in an institutional setting. We know COVID-19 vaccines are highly effective at preventing severe illness, hospitalization, and death, even against the Delta variant. But as the disease evolves, booster doses can further protect people. At this time, recommendations have not been made for people who received the Moderna or Johnson & Johnson vaccines. More information could be available in the coming weeks. I also want to clarify the difference between booster doses and third doses because they are not the same thing. A booster dose is given to someone who's completed the vaccine series and developed a good response. A third dose is an additional dose given to certain immunocompromised people who did not adequately develop immunities with the initial 2-dose series of Pfizer or Moderna vaccine. Now I want to give you an update on COVID-19 vaccines for kids under 12. It's one of the most common questions we are getting, especially with our youth back in school. Parents want to know, when can I protect my child under age 12? While I wish I had more to share, we're still waiting on information from the FDA and CDC, which we hope comes soon. Right now, students 12 to 17 are eligible for the Pfizer vaccine. And combined, about 48% of those teens or preteens and teens aged 12 to 17 are fully vaccinated. Let's protect our kids and keep them in the classroom by getting them vaccinated today. Vaccine supply isn't a concern like it was in the past. There's still plenty of vaccine available for everybody across the state, including more than 57,000 doses of the Johnson & Johnson vaccine. We know that's really important about where to get the J&J vaccine as we approach the October 4th deadline to be vaccinated for all the groups of people who are covered under the governor's COVID-19 vaccine requirement. Making an appointment is easy. Visit the state's vaccine locator website or vaccines.gov, where you can even search for specific vaccine types, like the single-dose J&J vaccine. You can also find locations near you by texting your zip code to GetVax 438-829 or call the COVID-19 hotline at 833-VAX-HELP. And don't forget, you can get the COVID-19 vaccine on the same day as you get other vaccines, like your annual flu shot. We are recommending that you get your flu vaccination before the end of October. COVID-19 vaccines are safe and proven effective. They can protect you from getting sick and spreading the virus to others. Across the country, more than 200 million people have received at least one dose of COVID-19 vaccine. The more people are vaccinated, the better off we all are. If you have questions, visit DOH's frequently asked questions page or talk to your trusted healthcare provider about the vaccine. Thank you.
Thank you, Michelle. Next, we will go to Lacey Fehrenbach. Lacey?
Good morning, everyone. Thank you for joining. I am Lacey Fehrenbach, the Deputy Secretary for COVID-19 Response at the Washington State Department of Health. Glad that you were able to join us this morning. I'm going to give a quick update on where we are in terms of data and trends for COVID-19 in our state. Overall, most of our trends are starting to show a decline, and that is very welcome and hopeful news. However, I want to be really clear that disease remains very high in Washington state. Our case rates, as you can see in the top of the graph, are starting to decline. We are seeing this trend statewide, and we're seeing flattening or declines in most Washington counties and across most age groups. However, disease does remain very high, as you can see, compared to our winter levels. We're just now coming below those peaks. Our 7-day rolling average for cases is 2,790. And that correlates to a case rate of about 579 cases per 100,000 population in a 14-day period. So pretty significant. Our hospital admission rates are also declining, but remain very high, much higher than we saw in the winter surge back in December timeframe. We are also seeing declines among all age groups here, except for pediatric patients ages 0 to 19. Those trends are flattening. So we hope that we will see them turn downward in the future, but we're not quite there yet. Our current 7-day rolling average for admissions is about 150 compared to 105 to 115 in that high plateau that you saw in the third wave. So that gives you some context about how much progress we still have to make in order to get disease rates low. Our hospitalization rate is 13.7 per 100,000 over 7 days. These are new admissions each day, and many people with COVID-19 stay for multiple days. So this means that hospital occupancy and ICU occupancy are still very stressed and high, those showing some slight signs of improvement. I want to also note that our state has passed a very somber milestone earlier in the week. We have more than 7,500 Washington residents that have lost their lives to COVID-19 since the start of the pandemic. And each one of these people, their life is a tragic loss to their death is a tragic loss to their family and community, and we mourn all of them. Unfortunately, we are seeing increases in COVID-19 deaths during this 5th wave. Our death data take longer to come in and be considered complete. As of late August, our 7-day rolling average for deaths was 35, and that compares to a peak of 41 in December. Trends in deaths typically lag behind cases and hospitalizations, so we'll be monitoring these data closely in the weeks to come. In the meantime, it's critical that we keep using all of the measures we know work to prevent disease and slow the spread of COVID-19. Vaccines are extraordinarily protective against severe disease and death. Unvaccinated 12 to 34-year-olds in Washington are 26 more times likely to be hospitalized with COVID-19 compared to similar aged people who are fully vaccinated. For people 35 to 64, if you are unvaccinated, you're 20 times more likely to be hospitalized compared to those who are fully vaccinated. And for people who are 65 and older, you're 10 times more likely to be hospitalized with COVID-19 compared to a fully vaccinated individual. By getting more people vaccinated, wearing our masks, and avoiding large gatherings, we can save more lives in the days, weeks, and months to come. We can also help protect our healthcare system for those who need it, whether that's for COVID care or other critical health needs. And we can help keep our children and staff safer in schools and childcare settings. There are hopeful signs in our data, but we are still in a very, very tenuous situation statewide. Let's keep working together to protect our families and communities from COVID-19. Back to you, Julie.
Thank you, Lacey. Let's now go to Secretary Shaw. Secretary?
Thanks, Julie. Can you hear me okay?
Yes, we can.
So I want to, I'm actually just going to first say a few things, and I want to introduce Dr. Getz, and then I will come back and say some additional things. So let me just start off by saying that I'm in Spokane today, and I am here with Governor Inslee, who visited with the team and teams here at Providence Sacred Heart in Spokane in the midst of what's going on with the surge across the state. And I want to just underscore what we spoke about and what the concerns were, very much highlighting the stress and strain that's within the healthcare system and really what's happening with individuals across our state who are entering into the healthcare system. And either they're, as you heard earlier in the governor's remarks, either care has been delayed or they're in a situation where they are with a preventable illness, COVID-19, that unless you're 12 and under or in a category where you are unable to get vaccinated, largely is a preventable disease. And so I just wanted to underscore what we've been seeing, what we've been hearing. I want to really talk about the leadership here at Providence Sacred Heart, led by Peg Curry and her team, as well as Dr. Getz and his clinical team. I met with some of the teams at the ICU, in the ICU, and also visited in the emergency department just a little bit ago. And also we met Alyssa, who Governor recognizes Washingtonian of the Day for her work as a nurse. And what was really amazing about her recognition is that immediately when she was recognized, she said, "It's not about me, it's about we, it's about the team." And she wanted to make sure to underscore that. I have a lot of things that I want to say after this, but let me pause there and just say I'm so incredibly privileged to have Dr. Getz, Chief Medical Officer here at Providence Sacred Heart, join us at our press briefing. He will underscore and highlight, I know, what providers across the system are seeing. And the number one message that we have for our community, which is the same message we had 2 weeks ago and even prior, is that while it's great to thank our healthcare heroes, and they are true heroes working day, night, weekends, holidays, just as our public health heroes are, the best way you can thank a healthcare hero is to do the things to help prevent the surge in our system, which includes getting vaccinated, masking up, and certainly doing everything you can to prevent you, a loved one, somebody you care about, somebody who's a neighbor, somebody who's in a grocery store, just to encourage them to get vaccinated. And if people have questions, that they go to somebody trusted like a healthcare provider It doesn't have to be a doctor. It could be a nurse. It could be a therapist, somebody who you trust, and ask them of the importance of vaccinations. And I just wanted to underscore that. So with that, Dr. Getz, are you on?
I am. Can you hear me okay, Dr. Shaw?
I certainly can, and I want to thank you again for joining us this morning. Floor is yours.
My pleasure. Thank you, and really appreciate your visit as well as the governor's visit to hear what we're going through. We're on this call because we care about you. And I think as we look forward to the winter season and all the holidays that come with that, we want your holidays to be filled with joy. And we really appreciate the thanks and the outpouring in the community, but what we really wanted is to see people get vaccinated. As Dr. Shaw toured our ICU today and spoke with the nurses and other team members, doctors, emotions were raw. And I think it's readily apparent that people are burnt out, and we're tired of seeing this needless suffering and this tragedy and the loss of life. I echo what Lacey mentioned about every death is a tragedy. And we have the solution. We have an incredibly safe, very, very effective vaccine that will keep you from coming into the hospital. It will keep you off a ventilator. And our ask is please take that safe vaccine. And if you have questions, as Dr. Shaw mentioned, please sideline one of us, sideline a family member or a respected friend that works in healthcare, and ask them your questions. We want to help answer those questions because the vaccine is overwhelmingly safe.
Dr. Getz, did you want to just say a quick few things about what you're seeing in the ICU setting, in the clinical setting, in the hospital system? I know, obviously, this is one hospital system that you're affiliated with, associated with, and leading, but you're also in touch with colleagues across not just Spokane, but East Washington and all the way across the state. Anything you want to also describe of what's happening within the healthcare system, and what are the kinds of things that both you're seeing, but also how it's stressing the system?
Yeah, one of the probably most difficult decisions we've had to make as a healthcare system here locally is to pause some of our surgeries. So since since the 7th of September, we've paused surgeries, and we've delayed care on over 2,000 people who need surgery. And we're talking about women with breast cancer. We're talking about people that have tumors in their brain or lung cancer, or have orthopedic injuries and chronic pain that we can deal with. And we've had to pause those surgeries to create extra capacity in our community to care for COVID. And that's directly related to our lower vaccination rates. It's not just Idaho, Eastern Washington, we're lagging behind. And so we have to work really hard to pull together as a team to try and increase vaccination. And the strain that this places on the entire healthcare team, all across the board, whether you're a lab technician or you're a patient transporter or you work in environmental services, we're all feeling the strain. And we want to go back to life as normal. And it's really hard being in this side of the country where we're seeing people come in with really preventable conditions. So please keep yourself safe.
Thank you, Dr. Getz, for that. And I know, I'm sure there are going to be some questions that are going to come your way during the Q&A period as well. Let me just underscore a couple of things that we heard, and also recognizing what Dr. Getz and his team have been really seeing and providing for not just a few days or a few weeks. This is months and months and months. The strain on our healthcare providers, the strain on our system is incredibly great right now. And while Lacey showed the graph and the trends, and absolutely we're starting to see a leveling off and even a decline, and that is incredibly heartwarming. We want to continue to see that. The reality is that the numbers are way too high. They're way too high for us to be able to sustain this kind of a system over time. And as I have said previously, it is like a rubber band. The rubber bands, you can stretch, eventually they will break. The other thing about rubber bands, and I'm not an expert, but I will tell you, is that rubber bands are also very much about tension. So even if you have constant tension, a rubber band over time can also break. So it's not just that you have to continue to increase it, but even a rubber band that's been stretched and stays at that same stretching over time can also break. And that's what I am worried about in our healthcare system. Not just that we're seeing a leveling off and we're seeing a potential decline, but there still is a sustainability to the fact that we have so many people that are seeking care from a largely preventable illness coming in on top of the heart attacks and the strokes and the usual reasons that people come into clinical care in a hospital setting, that is what is most concerning to all of us. And so it is absolutely critical that we keep in mind that while the trends are improving, I don't want anybody in the community to have any misgivings or misunderstandings about the fact that we are at a incredibly high number. And the fact that that number is also incredibly high, not just across the state of Washington, but in certain communities and certain hospitals, including our critical access hospitals in rural communities and smaller jurisdictions, that should be concerning to all of us. And what does that mean? That means if you are seeking care, if you are trying to get a procedure done, if you are you break your ankle and you are trying to get the care that you usually would be getting in that system, you are going to likely see delays. Unfortunately, if we keep stretching that system, those delays now get into life-saving, life-threatening care, and that is going to be an absolutely overwhelming situation that we want all of us to be able to help us prevent. So I wanted to underscore that. The other thing I wanted to underscore is the fact that when we're looking across the system and we're talking to healthcare providers, it's really critical that we also remember that healthcare providers are people too. They're part of the community. They're in the community. They are listening to people in the community. They're getting their own family members that are asking them questions. They're also having to field many of the same concerns, especially when we as a state and when we as a system say, talk to your healthcare provider, talk to your trusted clinical person that you go to for knowledge, for information. They're also part of the community. They're also seeing so much of what's happening in the community. They're seeing our communities ravaged by this pandemic, but this is our 5th time going through the same thing. And guess what? We are now losing lives. The difference from last year when we were here is that we did not have a modality to protect us. We had masks, we had social distancing, we had hand hygiene, and we had hand sanitizers. We said avoid crowds, stay at home. We now have something that we can use to protect ourselves from this horrible, horrible pandemic, but most importantly, from serious illness, hospitalizations, ICU level of care, and death. And yet, far too many Washingtonians have still not gotten vaccinated. So I urge all Washingtonians to get vaccinated if you're eligible, meaning 12 and up and no absolute contraindication to getting vaccinated. Get vaccinated. Please get vaccinated. Don't wait. As I've said throughout, don't hesitate. Vaccinate. I think that's a critical message. So I just wanted to underscore that. And then the last piece of this is the mental health and the strain and stress on our healthcare workforce. I will tell you, as part of that workforce over the years, it is not easy working in a healthcare setting, regardless, on a bright blue sunny day. But to do that in the midst of a pandemic that's just raged on for 18, 20 months and still counting, and likely as we start to see it getting cooler, we're going to start to see a very difficult winter ahead of us as well. I really worry about the mental behavioral health, and we're doing a lot of things at the state to help support our system. As you know, that means trying to get more resources from a personal standpoint into the state of Washington, do everything we can from a volunteer standpoint, and to really deploy as many additional resources that we can to help our systems. But ultimately, this is a mental health and behavioral health strain and stress on our system as well. And we want to make sure people are helping all of us get through this very difficult time. So with that, I want to say thank you, Dr. Getz, Lacey, Michelle. I know I missed the beginning of some of this as I was still talking to the providers and clinical care staff here at Providence Sacred Heart, who, by the way, are just doing incredible work, amazing work. And as Alyssa Bolt was saying, this is mission work, and this is work that really is not just in one hospital. It's happening across the state of Washington, across our country, across the globe, and we have to do everything we can to help support those very heroes. So with that, let me turn it back to you, Julie, for some Q&A. Thank you.
Thank you very much. And we will begin our Q&A with a question from Ariel from the Spokesman Review. Ariel?
Great, thank you. I'm curious how the Department of Health is going to allocate the monoclonal antibody treatments that we're receiving as a state, if those are going to go to more, or I guess to counties with lower vaccine rates, and also if Washington State has actually received less because our state's vaccination rate is higher. Thank you.
Yeah, thank you, Ariel. I'm gonna take a start with that, and then Lacey, if you want to add to that. What I would say is that first of all, there is now a shortage across the country when it comes to monoclonal antibody therapy. And while we do have access to monoclonal antibody therapy in the state of Washington, it is limited from what the demand is. The demand is higher than what we have the allocation for this kind of therapy. It's absolutely critical to remember that first and foremost, we don't want people to use the monoclonal antibody or the ability to get additional therapy once they're sick to be the reason not to get sick in the first place. In other words, get vaccinated, do all the right things up front, and let's hope that you never get into a situation where monoclonal antibody is what's necessary in order to prevent you from having more serious illness. So I do want to underscore that. What we're doing behind the scenes at the state was actually just that, Ariel, was working on our plans and working with our partners on how we would execute having the ability to provide monoclonal antibody therapy throughout the state of Washington. Just as we were getting closer to being able to execute on that, not that we already have not been working with partners in the healthcare system, but as we were getting closer, we were then notified by the federal government of this limitation, which now means that we have had to relook at our plan, including how we're allocating and where do we allocate appropriately, not just in communities and counties, as you mentioned, but also looking at it from a standpoint of who would be eligible for monoclonal antibody therapy. Again, this is where we start to get to this point of having to really make very difficult resource allocation decisions on constrained resources. And we don't want to get here. So that's why it's really important that we prevent it in the first place. So Lacey, any additional details you can certainly add.
I think you covered it very well. I do want to note we did have, a pivot to make with the change in supply, and we are working with our partners in the state and our tribal partners to come up with a prioritization process. We will likely include things like disease burden, hospitalization rates and utilization, because those are things that determine how we as a state get allocated monoclonal antibodies from the federal government. But we will have more to share on the prioritization after we finish that work with our key partners on the ground.
Dr. Getz, did you want to add anything on what you're seeing with monoclonal antibody therapy? I know we talked about that during our visit.
I think people need to understand that monoclonal therapy is good, but getting vaccinated is orders of magnitude better at preventing you from getting sick from COVID. So, we look at monoclonal antibodies as one of those things that we can use to hopefully prevent people from needing hospitalization. But when you look at the efficacy of the vaccine, it's greater than 90% effective at keeping people out of the hospital and preventing death. So people really need to realize if you want as much protection as you can get from bad COVID, that protection is the vaccine.
Well said. Julie, back to you.
Thank you very much. Our next question comes from Steve at Como. Go ahead.
Thanks, Julie. I have a question for Lacey and one for Dr. Getz. With Lacey, I noticed in your remarks that you had mentioned that we're starting to see declines in cases and hospitalization rates. And I believe I heard the word start about a month ago when referencing those two particular areas. And I'm curious if you can sort of put in perspective for us, how much progress have we really made over the past month? And when comparing this current fifth wave to the third wave, how long could it really potentially take for us to get out of that wave? I know we're at a higher point than we were during the wintertime, but sort of comparatively speaking, how long will it take for us to potentially get out of this? And with Dr. Getz, at Sacred Heart, I'm wondering if you're seeing any sort of impact from this apparent recent decline in new hospitalizations, or is it still as bad as it has been in recent weeks, or maybe even worse? Thanks all.
Sure, I can start. So on cases, and I think even hospitalizations, we did start to see a dip going into early September. And then we had a bit of a Labor Day rebound after the holiday, where there was a little, uptick in cases in particular. So there's kind of this like almost high plateau in the early part of September before on the epi curve, you'll see a good solid continuous downcline for several days, I think starting around 9/13. I will follow up if that is not the exact date. I have to look it up on the curve. But so that is, maybe why you heard start previously and now you're hearing it again. I think also, to just reiterate what Dr. Shah said, we're seeing some hopeful signs, and disease is still very, very high. Hospitalization rates are still very, very high. They're higher. Hospital admission rates are still significantly higher than they were at the peak of the third wave. And those are new admissions every day. So that means occupancy is very high. It continues to be high. And hospitals are not providing care to, they're having to delay care for non-urgent procedures. So we expect hospital occupancy and capacity to be very strained over the next several weeks to months. In terms of how long are we going to be in this, the answer really depends on all of us. Our ability to continue to drive down disease rates and drive down hospital admissions related to COVID depends on reducing the number of people who are susceptible to COVID in the first place. So getting vaccinated, and then also doing the measures that we know slow the spread, wearing masks, watching distance, keeping our social circles small, really important, and really, really important if you're not vaccinated or you have people not eligible to be vaccinated, that you take those preventive measures extremely seriously right now. But I think going into fall, we have a lot of uncertainty. We are planning for the worst and hoping for the best.
Before Dr. Getz speaks, I wanted to add one quick thing to Lacey, her comment, a nuance, which is while we're seeing the trends decrease across the system, whether it's in the community or in the hospitalization numbers, we are concerned about pediatric data. We are still seeing a decline, but not as steep of a decline in the age groups that are 18 and under, or under 18, I should say. And that is a concern. We're continuing to watch that. Obviously, we know schools have gone in person, as I've said many times. As you know, I have two children, my wife and I, that are in school. Many of us on this call have kids that are in school, and this is something that all of us are very concerned about and want to continue to watch very closely. We want to make sure we encourage everybody that's involved in the ecosystem of education, schools, whether it's the adult, the parent at home, a grandparent, the child, anybody who's a bus driver, anybody. We want to encourage everybody to do everything we can to continue to keep our schools open for in-person learning. And when we start to see some of those increases, again, it's not necessarily that we are seeing decline. And Lacey, make sure that I'm saying this correctly. We are seeing declines, but we're seeing not as steep of a decline when it comes to that population as I'm referring to. And we do believe that that is something we need to watch very closely, but it's going to be up to all of us to continue to keep those schools open in person. So with that, Dr. Getz, I'll turn it to you.
Yeah, thanks, Dr. Shah. From the standpoint of the Spokane area as a whole, I think all our hospitals in this community are still just uncomfortably full with COVID patients. Although we've seen maybe a plateau, we still today are at a level that's much higher than what we saw in the last winter surge, and nowhere near where we can resume normal operations. And that's what concerns us. I don't think we know when we'll see us return to a volume where we can start doing surgeries at the level that we were doing before. And that's why we just implore people, one, to get vaccinated, And then two, follow those common sense measures that help reduce the spread of this virus. We're asking North Idaho, you're our neighbors. I think putting masks on in school is not a big thing to ask. And, all three of my kids go to school and they wear masks and they have a good day at school and they come home. And we're asking the same thing that healthcare leaders and physicians and nurses in your own community are imploring you to do. Adopt those measures that keep you safe, and please get vaccinated. And then we get back to business as usual.
Thank you. We have 6 reporters left in the queue, and our next one is Jessamine from Q13. Go ahead.
Thank you so much for your time. Very much appreciated today. I wanted to ask about looking at the state's vaccine mandate deadline as we approach October 4th. Not only are we at risk for losing healthcare workers who refuse the vaccine, but critical first responders, law enforcement officials. Could we be looking at a public health crisis within a public health crisis due to that loss? And then my second question is, what impact a government shutdown could have on our state's COVID response?
Let me let Lacey handle the government shutdown piece, because she's been keeping track of that with our team when it comes to the resources that are coming into the state. Let me take that first question, and Jessamine, thank you for the question. We hope that we do not see that. We hope that people who are in these professions recognize, just as Dr. Getz and I recognize when we get vaccinated, that we're ultimately protecting not just ourselves, but we're protecting the people that we are serving. And whether that's the patient or whether that's the community member that's coming in, or we're serving in the midst of fire work or law enforcement work, or whatever the work is from that standpoint, we hope that people recognize that we're in this profession also not just for ourselves, but it's also about mission work and also helping protect the very people that we are charged with helping and serving. So I hope that people will recognize that as well. And we've said it before, that it's not just about the me, it's about the we, it's about all of us and doing that. And so we don't want anybody to be leaving the fields of, especially in healthcare at a time where our healthcare system is so under duress. We absolutely do not. We're also watching what's happening across the country. And as you know, we're watching, as all of you are, in New York State and other places where hospitals or healthcare systems, for example, Methodist Hospital in Houston, where I was previously, just the kinds of things that people have been doing, and what is happening in those systems when they put in requirements or mandates. That is so critical to the real equation here. We are hopeful that we are not going to be seeing any additional folks that are going to leave these professions that are very difficult to recruit for, difficult to retain, especially during a pandemic. But the reality is we are also watching very closely, and we're recognizing that we're still a couple of weeks away from the October 18th timeline. Obviously, the last time that an individual could meet with the 2 weeks would be October 4th with the J&J vaccine, which is next week. So we're hoping that we're going to have more people who are on the fence, who some have very reasonable reasons from their standpoint that they think that they should hold off. But we hope that they will talk to a healthcare provider. They'll talk to someone who has seen people get sick, seen people in the ICU, seen people that could have been prevented, and why they would encourage those same individuals to do the right thing and get vaccinated. So I would say that we are hoping to avert any type of crisis or worsening of the situation. We're already in a very difficult period in our state of Washington, but we have to do everything we can to remember the big picture, which is it's not just about us, it's about all of us. It's about how do we protect others around us that we're also charged with protecting in that very community service or line of service that we have chosen. So with that, Lacey, let me turn it to you for the federal funding piece.
Yes. So if the government were to shut down, and I'll start by saying we hope our elected leaders in Washington can come together and avoid that, in the other Washington, that they can come together and avoid that situation. The majority of our public health work and certainly our response work here in Washington would continue forward. As state employees, we have flexibility, in most of our programs to do that work because the funding comes to us in the form of grants. We may have some hindrances in that we might lose access to some federal employees who are not available to us, though sometimes in emergencies, even those federal employees get exempted from the shutdown. So we are working very closely with our federal partners and our team to plan for carrying forward if there is a shutdown, and certainly hoping that Congress can come together on a continuing resolution and a way to address the debt ceiling so that we avoid those impacts. And on the second point, that is not so much about COVID, but very impactful to families if we are not able to address the debt ceiling, or if Congress is not able to address the debt ceiling, because at that point the country is not able to pay its bills and lots of programs grind to a halt. So it is very imperative that our elected leaders come together and figure out how to move forward.
Yeah, let me go one further. The last thing, and Lacey was being kind on that one, is it would be an absolute travesty if in the midst of a global pandemic that this country is being ravaged across the system, if our federal government can't come together and continue to operate and resource state and localities that are doing everything they can to support our communities. So that would be an incredible travesty, and we hope that everybody comes together and we do not see that, because that in the midst of a pandemic is not the right decision. It's not the right move, and certainly it can harm and hurt so many people across this country.
Thank you. Our next question comes from Nicole from Cairo Radio. Go ahead.
Good afternoon, because it's afternoon now. What are our options with Idaho at the moment? I know that we can't turn away patients coming from Idaho, but is there any way that we can impose any sort of precautions for them, or sort of sanctions, so that we're not enabling their lack of precautions and it's detrimentally affecting our own hospitals and our own residents? And then how is the state helping schools in our state with outbreaks? Is the state helping with contact tracing? What does that process look like?
Let me let Lacey handle the outbreak in schools piece, and then let me come back, and Dr. Getz, I'm sure, will have some comments as well on the Idaho piece. So Lacey, you want to go with the school one first?
Yes. So within the K-12 requirements, part of what schools have to be ready for in partnership with local public health is to respond when there is a case or an outbreak in school. In terms of supports for schools, we do have a guide for contact tracing and isolation and quarantine within our supplement to the guidance, and that's on our website. We also are working on some simpler tools that schools can have in their hands as they are, sort of walking through classrooms to identify close contacts and then help the families with the isolation for a person who has COVID, or quarantine if they're a close contact, in partnership with OSPI and local public health. We also help with testing. We have, I believe, more than 75% of districts in Washington state are enrolled in the Learn to Return program, which provides timely access to diagnostic testing for students and staff. And then in some schools, either repeat testing of athletes or other participants in athletic and extracurricular activities, or students generally. So, and we continue to take additional schools to enroll in that program, and allow schools to change what type of testing they offer. We actually tomorrow are doing a special session for the Learn to Return participants around responding to outbreaks. So this, the really important message for parents and the public is that, disease rates are high. And the higher disease rates are, the greater the risk for introduction of a case of COVID there is to a classroom or school. That is just the reality. And that means that our schools right now are facing a very heavy workload, just like public health is in the broader community in responding to cases and outbreaks in the school environment. And we are here to help them and help them navigate through this, and do that balance of keeping schools open to the greatest extent possible, so long as it's reasonably safe to do so, and also controlling disease spread. And it is a very tough balance, and it's very challenging for people in local public health and in schools on the ground.
Yeah, and I'll just add on the last point is that, and Lacey's absolutely right, the joy that we've seen with our children being in school, and there was a lot of anxiety, and there continues to be concern when parents are dropping off for that first day or the first week, and some of that has subsided, obviously, in some places, even in my own children's school, that there are notes that have gone or emails that have gone that said there's been a case or somebody, and fortunately our two kids were not exposed. And this is something we're going to continue to be grappling with throughout this school year. And we want to do everything we can to keep schools open for in-person, because I'm telling you, and Dr. Getz and Lacey, Michelle, all of us have kids in school. And I will tell you that I myself am seeing a change in the way our children are behaving even now compared to how they were last year when they were not in school and they were virtual. There's almost an improved outlook, and we want to do everything we can, and it's going to be up to all of us to do everything we can to keep our schools open. As far as Idaho goes, we're in touch with our colleagues, public health colleagues in the state of Idaho. I'm also on a regular basis in touch with Dr. Stephen Mitchell at the Washington Medical Coordination Center, Washington Medical Care Coordination, through what's happening at WMCC on a regular basis, which includes trying to get an understanding of what's happening from the state of Idaho, and not necessarily at the state level, but because, as you know, a lot of this is also happening at an individual level or a healthcare level. It's not necessarily government to government. It's really what's happening if somebody drives across the border and shows up in Dr. Getz's hospital. And obviously we have EMTALA and all sorts of other stipulations on what we need to be doing in a healthcare setting. The other piece of this that's really critical is that we are also trying to get an understanding on what is the more formalized process for transfers that are coming from the healthcare sector in Idaho to hospitals in Washington. As you know, for example, Harborview or even Providence Sacred Heart, these are hospitals that are regional hospitals. They, in usual times, take patients from all over, not just Idaho, but all over multiple states. And we want to continue to be able to do that as much as we can. There comes a point, though, that we have to be really mindful of what's happening in our state. And if we, as Washingtonians, are not able to get access to healthcare resources, and it's happening because of any state, not just the state to the east of us, but any state, that is something that we're going to need to be looking at more cautiously. At this point, we continue to monitor what's happening. Dr. Getz, I'm sure, can provide a little bit more detail. I believe the number that was used is that maybe there are 30 or 40 people from Idaho every day, I believe, Dr. Getz, that are in Sacred Heart, for example. And so maybe you can just provide that on-ground perspective of what's going on.
Yeah, that's a pretty good estimate, Dr. Shaw. We're the highest level ICU. We're the only trauma center, and we serve Eastern Washington, Northern Idaho, and parts of Montana. So these people have always been part of our healthcare community, and it's really important. We want to continue to serve them. But I think it's important to remember that we're not talking about just taking care of people with COVID-19. If your child's in a bike accident and they have a bleed in their brain, if you're in a car accident, you need our trauma center, and we need to have people, space, and stuff to care for people. If we're saturated, we can't provide the care because we don't have enough staff, we don't have enough physical space, we don't have the supplies, then we can't accept patients into our facility. And that's my biggest concern about these more rural communities. If you come into a small ER and you have a heart attack and the large ER is not able to accept you, you're going to receive lower level of care. You're not going to be able to have that stent put in. And these things are life-saving measures. And the only way that we can prevent that happening is to get vaccinated and wear our masks and do everything that we can until we have vaccination up to a point where this is no longer a public health threat.
And we want to encourage, obviously, our colleagues and neighbors in Idaho and elsewhere across the entire country. It's an ecosystem, right? It's a pandemic is not a pandemic in a state. It's by definition, it's a global pandemic. And we want to encourage everybody across the system to do the right thing and put those policies in place to really mitigate people coming into the healthcare system wherever they wind up getting into the healthcare system. I was remiss in WMCC, it's the Washington Medical Coordination Center. So I just want to make sure that I appropriately gave the acronym. Julie, back to you.
Thank you. We have 4 reporters left in the queue, and we will run a little bit long to accommodate everyone, also because we started a few minutes late. So now we go to Allison from Cairo. Go ahead.
Thank you so much. I have 2 questions. The first one, Michelle mentioned the vaccination rate for 12 to 19-year-olds at 48%. What's your reaction to that number? It seems like the lowest number among different populations. What's your message for parents? What needs to happen there to keep schools open? The other question is about outside help from the feds, help from out of state. Is it coming? Thank you.
Well, first of all, thank you, Allison. As you know, Governor sent a letter to the White House. I sent a letter to the HHS Secretary. We are already been told prior to that the state of Washington was able to access through the GSA contracting process, personnel resources, and certainly we're now working with our healthcare providers systems that had identified they needed additional support so that we can help them with how do they go about getting into that contracting process. So that's one piece of it. We do not know yet. We're hopeful, but we do not know yet on what additional federal resources from a personnel standpoint that we are going to be able to get into the state of Washington. And this is not for a lack of the federal government not wanting to support. It's the fact that this same issue that we're having on personnel constraints is happening across the country. And we are, unfortunately, it's not a competition piece, but we are unfortunately competing with similar requests that are happening across the country. And so it was very important for us as a state to make sure we were at least raising the flag and articulating why we needed personnel support help as well. So I wanted to make sure that was clear. Allison, I am sorry, I completely forgot your first question.
It was about the percentage of our young children who are vaccinated.
Yes. Well, I will tell you, my 12-year-old is not one of them. She has gotten her first vaccine, and Dr. Getz shared that he has a child who I believe is just under 12, and she is waiting, if I remember correctly, waiting to turn 12 to be able to get vaccinated. So this is something that's close to the heart for many of us. And we are going to do everything we can to increase the vaccination rates in every demographic. And we've been doing a lot of things across the system, whether our caravan work or POP initiative, working with OSPI, et cetera. So many different things that we've been doing so that we can continue to increase and enhance our vaccination numbers. But Michelle, did you want to add additional details there?
Yeah, I'll just add, I'm also a parent of a vaccinated child. So my daughter is 13 and she did go get her first dose the first day. Vaccines were licensed for age 12 and up. And I'll tell you, for this school year, it's really made such a huge difference, especially in all of my family's mental health, to have her back in school, to have her interacting with her friends and peers and her teachers, and also just for my peace of mind that she's going to be protected against the most severe outcomes from this disease, and she's able to do some things that I said no to for a year and a half. So that really has helped all of us feel a sense of some normalcy. I will say that when you look at, and there's a graph on our website we can direct you to that looks at vaccination rates by age, the highest vaccination rates are in older adults, and then kind of the percent of people vaccinated decreases as you go to younger ages. Part of that is because it takes time to reach high vaccination rates, and our older adults were the first groups of people to be vaccinated. I think part of it is parents thinking kids haven't been as much at risk in the past. But we did talk about earlier that there's still 1.5 million people in our state who are eligible for vaccine who have not started yet. And that means more of them are young. And as we have higher vaccination rates, that's one of the reasons we're seeing increasing disease in our younger people, because that is the susceptible population to disease. And it really does leave them at risk. And we worry about that, especially with the school conditions, as Lacey was talking about, when we have high rates of disease. That is going to impact everybody who is unvaccinated in all the settings, especially when people are gathering. So we really we understand this is a decision that parents need to make and need to feel comfortable with. And we really want to encourage people to talk to their healthcare provider. We have lots of information, but I'll tell you, as a parent myself, the relief of knowing my daughter is protected from the most severe outcomes and can do some of the things that bring her joy and help fill her cup is really critical for me feeling comfortable as a parent for every day as she navigates the world.
I can quickly just add, the greater the vaccination rate in a school is, the safer it is for everyone in that school. And, you know, we talked about rates by age. If you look by age and geography, there's a lot of variation as well. In some counties, the vaccination rate of teens is in the mid-20s, and in others, it's in the 70s. And so that is a huge gap that we're working to close among our communities in Washington State. And, you know, I also want to add that there is emerging evidence out there that, you know, increasing vaccination rates in a community helps with protection of COVID and specifically hospitalizations due to COVID among younger children who are not yet eligible for vaccination. And I have 2 of those in my household. So really want to reiterate Michelle's point that if you're a parent or caregiver of a child who's eligible for vaccines, please talk to your healthcare provider, take your questions. They are ready and they want to talk to you about this. They will answer your questions, address your concerns, keep the conversation going. This will protect your child and the broader community. The other thing I want to remind parents and caregivers about is if your child is fully vaccinated and they are exposed to COVID at school, they get to stay in school. They do not have to quarantine unless they have symptoms.
Thank you very much.
Can I just add on to that real quick?
Oh, go ahead,
I think
please.
it's so important to note, and I hear people question this, being vaccinated clearly reduces your ability to spread this disease. So again, it not only protects you, but it makes you much less likely to give it to somebody else.
And masking in schools is also critical. And I would just refer you to the research that just came out from Arizona on the importance of masking and its impact on case numbers and case rates when it's compared to those schools that do not mask. So I do want to make sure that we model the right behaviors, that all of us as parents and as adults, you know, when we see our kids doing certain things, we don't like it. But I know when at the end of the day, when we champion those same behaviors by getting vaccinated ourselves, masking up ourselves, making sure that we're careful what we do and how we go about our lives, and our kids are seeing that, then they also model that, they mimic that when they're in school, and we want to make sure we have that kind of an encouragement as well.
Thank you. Our next question comes from Kate at KUOW. Go ahead.
Thank you so much for taking the time, everyone. I have two questions related to the vaccine mandate. With the deadline approaching on Monday, as you noted, for folks to get their final shot, can you tell us what you're seeing among healthcare workers in the state? Do you have any idea at this point how many healthcare workers have initiated vaccination or have completed it? And then my second question is, can you just clarify a little bit what that October 18th deadline actually means? Does that mean that healthcare systems and other employers have to fire folks who are not in compliance on that date, or can they simply, take them off the schedule, put them on unpaid administrative leave, and try to keep convincing them to come into compliance? Thank you so much.
Yeah, thank you, Kate, for that. I'll and I'm going to defer to Michelle and Lacey on this one, but I will make a couple of comments. One is that as the governor made it very clear, this would be a condition of employment, and so October 18th would be the date by which individuals who are in those categories would, unless they have a closely held religious exemption that's granted, or medical exemption, that they would need to be vaccinated. Now, since that proclamation, there have been negotiations that have occurred with unions and other employee sectors that have modified some of that. And so in some cases, for example, the employee, again, depending on if they're in those categories, could potentially not be let go on, let's say, October 19th, but could remain in place with some ability to keep them away from those individuals that they're, for example, in a healthcare setting, caring for through the end of the year. So there are some moving pieces related to this, but it's been very clear, and the governor's made it very clear that he believes in vaccinations, as we all do, and as a condition of employment, vaccinations would be required by October 18th for an individual to be fully vaccinated. To clarify, that does not mean that they would need to get the booster dose of vaccines, but really either 2 doses of Moderna or Pfizer, or 1 dose of Johnson & Johnson vaccine. And so that's what we're watching. Now, as far as what we're seeing across the system, Lacey, Michelle, do you want to add anything else from I know some of our data are moving, but also I believe they're hard to know at this point, and we're going to get obviously more information. As I mentioned, we're also watching what's happening in other parts of the country as well. So Michelle, Lacey, anything you want to add?
Yeah, I'll just say we don't have exact numbers by profession, and really that exemption and accommodation process is handled by each employer. So we really can't speak for individual employers about what's happening. But we can tell you, like I started off today with the good news, that over the last month, the number of people who have initiated vaccine across the state has increased 25%. And so that is good news, and movement that some people are getting vaccinated. So I think we'll hear much more from employers as that October date nears. As you said, the October date is when people need to be fully vaccinated. So the last day to get a dose of Johnson & Johnson vaccine is this coming Monday, October 4th, to meet the requirement. And then each employer is really responsible for the process, and it's a 2-step. If for people who are asking for exemptions, it's for religious or medical reasons, to determine if they meet an exemption and they can grant the exemption, and then to determine if they can reasonably accommodate under the reasonable accommodation federal laws that person. And so it's going to differ by job type and job duties, and then what accommodations an employer may decide to offer them, and that could be different from employer to employer. But they will not be able to work in person on October 18th if they do not have an accommodation that is complete.
Yeah, on October 19th. The other thing that I want to just focus on just for a moment is that we are oftentimes asked the question of how many people are not getting vaccinated, but I want to make it very clear that when you're looking across the country, whether it's in New York or United Airlines or Methodist Hospital in Houston or elsewhere, the vast majority of people that are in those categories actually do get vaccinated. And I think it's really important to focus on that as well. Vaccine requirements actually do work. And it is so important when you're trying to fight a global pandemic that we get people vaccinated, as all of us have said, but especially as Dr. Getz had mentioned on a couple of occasions. Lacey, I think you came off mute. Did you have something you wanted to say?
I do. I actually want to do a quick clarification on the prior question because some people have texted me follow-ups. So if you are fully vaccinated as a student or staff member and you're exposed to COVID-19 and you don't have symptoms, you don't have to quarantine. If you have the rare event of a breakthrough case, then you would have to isolate. So I want to make sure that's clear for the audience and the reporters. So being fully vaccinated saves you quarantining if you're a close contact or exposed in the school environment.
Thank you very much for that clarification, Lacey. We have 2 reporters left. Our next one is Sally from South Seattle Emerald. Go ahead.
Hello, I have 2 questions. The first is whether Dr. Shaw could comment on equity and disparity in relation to the boosters and whether the state has a way of measuring whether the uptake of boosters is equally distributed among different ethnic and community groups. And the second question is for Dr. Shaw also. Can you give us a metric that you're using to measure the non-COVID patients turned away? Because I'm not a mathematician, but it seems to me that the unmet need is building and building week after week as hospitals remain overwhelmed. And it seems difficult to understand how that unmet need is going to finally be met.
First of all, thank you, Sally. I'm hoping I got the gist of that last question. I may actually need to have you clarify that, but let me at least try to take a stab at what I think you were asking. When we're across the system trying to determine who may have delayed care or not received care, that is, as you know, a very intimate decision that's being made by the clinician and the patient. If a clinician is making a determination that that person's care is urgent, emergent, especially if it's life-threatening, then that individual is getting that care. If that individual is determined by the clinician not to have those to that level of urgency, then there are delays happening in the system. The challenge we have is that there are gray areas between what is considered urgent and life-threatening or potentially life-threatening, and those conditions that are not or could be subject to delays. We do not want to see anywhere in our state the delay of life-threatening, immediately life-threatening conditions. I cannot say 100% that situation may not be happening, because the more the hospital and healthcare system is strained, the likelihood of something like that or a scenario like that happening is there. And so we have to acknowledge that this is not a theoretical problem. This is a practical issue. This is an issue that you only have so many resources. Those resources, especially people, personnel, doctors, nurses, respiratory therapists, non-clinical staff, you only have so many of those people who are providing care. And if you continue to stretch the system, eventually you are going to have people that are potentially not going to be able to get care. And that is going to be a very difficult situation, even worse than what we're concerned about now. So I want to make sure to clarify that. When it comes to boosters and equity, this is a really interesting question that you asked. And I will say that we are not in the same kind of situation as we were back in January, where there were not enough vaccines to go around, that the federal government didn't have the supply of vaccines. We have been assured that we can get vaccines for Washingtonians, that the vaccines are available. It's a matter of ordering and get those vaccines. Does that mean the moment you say, I want the vaccine right this moment, you're going to get it? No. Does that mean that you are going to get the vaccine from a booster standpoint and you're going to still be protected? Absolutely. But it's also critical for us to keep in mind that vaccine boosters is not the same thing as getting your first dose, which was a flick of a switch, which means that you went from zero protection or protection with a mask, zero protection, to some level of protection, whether 60, 70% on that first dose, and then bumped up with your second dose, whatever the case may be. You're now talking about waning immunity from that initial vaccination, which means that the immunity does not stop at your eight month mark like that. It is more of a dial, that it starts to dial down, that you start to have decreasing in immunity, and we cannot predict who's going to be in which category and when their immunity is going to wane. And that's where the federal government put out for the boosters to be able to get people who are in higher risk categories, however that's defined, to be able to get vaccinated with their booster dose. From an equity standpoint, we believe we have plenty of vaccine in the state of Washington. We have also, over the last 6 to 8 months, done everything we can to champion not just equity, but public-private partnership and innovation. Our Vac Center, our vaccine implementation collaboratives, the VIX, that was really about equity. And we believe that we have done a really good job of prioritizing equity, even in our outreach and engagement efforts. Does that mean that we have closed the gap on everything? Absolutely not, Sally. We still have work to do, and this is going to be continuation of the work that we have engaged in for months and months and months and years and years and years. However, we do believe that no matter who you are, where you live in the state of Washington, that you should be able to get access to booster vaccine. You just may not be able to get it immediately. It may be, again, that you might need to wait for your appointment, which may be a few weeks away. But guess what? Your immunity also doesn't drop immediately at the 8-month mark. So I hope that helps, Sally, in answering your question. I wanted to make sure to spend a little bit more nuanced time on it, because it is a really important question. We continue to champion equity, and we believe very strongly in the core principle of equity and equitable access to vaccines, all vaccines across the system, all COVID vaccines, and in this case, equitable approach even to boosters for COVID vaccines as well. Thank you.
Thank you. And our final question comes from Elise from the Seattle Times. Go ahead.
Hi, yeah, thank you all so much. So a couple questions have already gotten to this bit already, but I just wanted to double check again something Lacey mentioned earlier about pediatric hospitalization rates in comparison to other age groups. So are those rates for younger kids flattening, or are they declining? And then, you know, either way, could that slower trend be attributed just to in-person school and the lack of vaccine approval for younger kids, or is there anything else that might be playing a part?
Thanks. So the first thing I want to say is the rates of hospitalizations for pediatric ages are low. And so the graphs, if you go to our dashboard, they're pretty noisy graphs. The rates do appear to be flattening. I think it's probably too early to say declining. The areas where it looks like they're declining for 14 to 19-year-olds, 11 to 13-year-olds, and 4 to 10-year-olds are in the incomplete data. So we have to wait a little bit before we make a determination there. I do want to note the rate is highest actually, and it's still relatively low, but it's highest actually among 14 to 19-year-olds. And those are children who are eligible to get a vaccine. So We really encourage our adolescents and their parents who are not vaccinated to talk to their healthcare providers and get their questions answered and get that protection, because the vaccine is extraordinarily protective against hospitalization. We do have flattening rates also in the 11 to 13-year-olds and 4 to 10-year-olds. And again, these rates are all relatively low. We're talking, between 1 and 3 hospitalizations per 100,000 over a 7-day period. So they're pretty low rates, but we really don't want any child to be sick enough that they need to be in the hospital, especially when that can be prevented.
Thanks, Lacey, for that clarification. Julie, with the provocative close there, I am going to take the privilege to just close us out. But I wanted to give Dr. Getz a moment if you wanted to champion any messages in closing as well.
Yeah, I just want to say on behalf of Providence, we love caring for people in our community, and we're dedicated to caring for the poor and the vulnerable. That's part of our mission. But what's most important to us right now, I think the biggest opportunity is trying to reach those folks that haven't been vaccinated, because it's incredibly effective and safe. And I understand there's a lot of talk about anti-vax, and I understand that hesitancy does not equal anti-vax. So we want to help and provide opportunities for people that have questions, a forum where they can address those questions, working with elders in the community, people that are respected, as well as your healthcare provider, whether it's a family member who's a nurse, or it's your physician or your advanced practice provider. Please come to us with those questions so we can help answer those questions for you and help you make as educated as decision as possible, because we're seeing daily people get very sick and sometimes dying from a disease that is preventable.
Thanks, Dr. Getz. Thanks for being here this morning into the afternoon, and also thank you for what you and your teams are doing, and teams like yours across the state, caring for people in very difficult times, and really making sure you're doing that in a compassionate way is so critical to the work that all of us are engaged in. So I want to thank you, Dr. Getz, and hopefully we don't need to have you on soon because things have gotten better, but I suspect, unfortunately, that we're going to continue to be in this for a much while longer here, unfortunately. I want to thank Lacey, Michelle. I want to thank Julie. I want to thank all of our team. I want to thank our media partners. And I just want to say thank you to our community members. By and large, the vast majority of Washingtonians have done the right thing by getting vaccinated. They're masking up. They're doing the things to help protect each other. And that is so key to the work that we are all engaged in. Sometimes we focus on those who haven't done those things, but I also want to have an incredible amount of humility and gratitude to the people that have just done so much to help fight this pandemic. And it is frustrating for all of us when we are still in this, and we were hoping that when we said in the summer, just hang on a little bit longer, and here we are, and we're still seeing the ravage of this Delta strain that is continuing to hit us really hard in the state of Washington. We're doing everything we can at the state level. I know all of us on this media briefing, but also well beyond this media briefing, are doing everything we can to support each other. We do know that it is important for us to help reduce the burden within our healthcare system. And the only way to do that is to get vaccinated and to mask up and do all the things that are common sense approaches to how do we help each other through this very difficult time. And I hope that's what you're going to do, is to help each other and help all of us be able to fight this pandemic. And with that, I just want to thank everybody. I want to also remind you to get vaccinated if you haven't already. And if you have questions, please ask somebody who has credible knowledge of vaccines and this pandemic on how you can get that good information so you can make the right decision. And hopefully you make that decision sooner than later and protect yourself and each other. And with that, I will turn it back to you, Julie.
All right. Thank you to everyone. That concludes today's media availability. Have a great day.